The meeting will begin in about 4 minutes. The meeting will begin in about 3 minutes. The meeting will begin in about 2 minutes. All right, Tracy, I have 2 o'clock Eastern time, 1 o'clock Central time, if you'd like to get us started.
Well, good afternoon. Thank you all for joining us today for our weekly update of COVID-19 across the Lake Cumberland District. We have some members of our executive team who will be answering questions. I'm going to turn it back over to you, Sean, and let you give an update of the cases and what's been happening over the past week.
All right, well, in a moment, I'll let Stuart say, I think, Stuart, you're in the dock, aren't you? You can do the board for me. What's been going on the last week? We've been working pretty hard with the schools, trying to help them be prepared for in-person instruction. Some have gone back to in-person instruction, and some are anticipating going back to in-person instruction soon. Uh, the schools are adjusting to the new reality of this COVID-19 situation, and it'll be a struggle for them. We know that the schools have put together really good plans, and we want to work with them as best we can to help this situation be as successful as possible. So, Stuart, do you want to give a case count update?
Yeah. Okay, so as of today in Adair County, we have 18 total active cases, 1 hospitalized, 19 deaths for a total of 322 cases. Casey County, we have 4 total cases. None of those are hospitalized at this time. 16 deaths and a total of 275 cases. Clinton County, we have 16 cases active. None of those are hospitalized. And we have 2 deaths and a total of 124 cases ever in Clinton County. Cumberland County, we have 5 active cases, none in the hospital, no deaths, and a total of 106 cases in Cumberland County ever. Greene County, we have 19 active cases. 1 of those is hospitalized, 9 deaths in Greene County, 281 cases ever in Greene County. McCreary County, we have 44 cases that are active, 2 in the hospital. We have 0 deaths in McCreary County, 185 cases ever. Pulaski County has 54 active cases, 4 of those are hospitalized, 10 deaths, total of 819 cases ever. Russell County has 15 active cases, 3 of those are hospitalized, 6 deaths in Russell County, 268 cases ever. Taylor County, 24 active cases, 1 hospitalized, 7 deaths, and 304 cases ever. Wayne County, 32 active cases, 2 hospitalized, a total of 0 deaths in Wayne County, 158 cases ever. And for the district total, as of today, we have 14 cases that are hospitalized. We have 231 active cases. We have had 69 deaths, 2,842 cases ever. And today's numbers, we have additionally 1 case in Casey County, 1 in Cumberland, 1 in Greene, 6 in McCreary County, 6 in Pulaski County, 1 in Russell, 7 in Taylor, and 2 in Wayne, for a total of 25 additional cases today at noon.
Yeah, and so for the last couple of weeks, our growth rate has been a little lower than the state's growth rate, which is good. But our growth rate has started going up again. We had a few, 2, 3, maybe 3 or 4 weeks there where our growth rate was going down, and now it's started to pick back up again. It's also picking back up at the state level. So I think I'm pretty sure last week was the statewide. It was the worst week since the onset of the outbreak as far as new cases. So that's not good news that we're still having increase in the new case rate.
Okay, thank you all. I want to remind everyone that the chat box is there. If you have questions as we go through out the meeting, please type those in, and we'll answer them as they pop in. Are you all ready to start?
Yeah, and Tracy, you're fading in and out a little bit.
Okay, hopefully I can fix that. First question, is the spike in cases in Macquarie County due to the Blazing Bluegrass Festival?
Stuart, is that you or me? I can take a stab at it. I answered. I mean, that's something that we just don't know. I guess from a a technical standpoint, when we're doing our contact tracing, we're trying to determine, close contacts and in situations where we have these big festivals and things, you don't know how many people you cross by, so it's not helpful for us to gather that kind of information. But it's just not something that we know.
Yeah. A lot of times I will say, especially with things like tent meetings, and we've seen cases in tent meetings, we do see, we see people that's had some experiences or some travel related or some things that they've done in common. And when we see that, we do put those together. But in the case of the Blazing Bluegrass Festival, at least we don't have any information that leads us to believe that there was a spike in cases due to that.
What we can say is, like after the 4th of July weekend and after the Labor Day weekend, about 2.5 or 3 weeks later, we did see a change in the community statistics, and usually you will see, so there is an impact, when more people are out and about. It's just kind of hard to know specifically, where the specific cause of that is. I guess just in general, the more people that are out mingling around, the more there's going to be transmission of COVID-19.
Yeah, and just one other thing on festivals, fairs, things like that. I guess two things. One, there is guidance out there that allows these type of things, these type of activities. One, that doesn't mean that it's safe because there's guidance. We hope that by people follow the guidance, the organizers of these things, that they make it, they lower the risk. Doesn't mean that there's no risk. So you have to decide, first off, are you willing to take a risk, whether it's a heightened risk or a lowered risk? When you're looking at this, you've got to decide that for yourself. Second thing is, if you are going to attend anything like this, again, remember how many times that it's our same message, wear your mask, socially distance, try and stay away from people that are not in your household, wash your hands frequently, and sanitize surfaces. So that goes, it goes the same for a festival as anything else that you would be out doing. But, one, before you go to something like this, remember that there is a risk. And if you do decide to go, please make sure and take the precautions that we've talked about.
Yeah. When you go to an event, they may limit the amount of people they allow in the venue, and they may have signs posted everywhere about masking and using hand sanitizer. But it's still up to the people who goes, once you get inside, to remember you need to mask and social distance, because these event planning, they don't have the staff sufficient to go around and patrol this and to try to force everyone to remember to keep your distance and wear your mask. So we all have to take some individual personal responsibility in these situations.
Yeah.
Okay, next question. Why do families have to wait for near-death vitals before they can be at a dying loved one's bedside in nursing homes? We want to be with them while they still understand us and can talk to us. Families are willing to put on any protective garment and such as required.
Yeah, but why don't you go ahead and read question 3 also? We might answer those together.
Question 3 says, what does CMS, which stands for Center of Medicaid Services, have to do with such decisions?
Yeah, so it's my understanding that CMS is the state authority that provides the guidance to the nursing homes. Is that right, Stuart?
That's correct.
So it's in their jurisdiction to set those rules. And those rules are available on the state's COVID-19 website. So, feel free to go there and look and read those guidelines yourself. As far as your question, first off, we don't set those rules at the health department, so it's not within our jurisdiction to second guess. We do understand that creates an extremely difficult situations for families, and we're sympathetic to that. We know that your loved ones who are in these facilities want to have visits, and we know that you love them and you want to be with them. And I can speak from personal experience. People I know that have had loved ones at the end stages of life who were in a nursing home and couldn't get in to see their loved one. It's extremely difficult. So I understand how agonizing that is. I feel very confident the reason why the rules are in place is to try to prevent a mass cluster of cases in those facilities where there's really a high risk population. That doesn't mean though that it's not agonizing that you can't go in and see your loved one. So it's probably nursing homes is probably the most double-edged sword of a situation you can imagine. In order to try to protect that age group, it requires separating us from the people we love, and it's very difficult. I don't claim to have an easy answer or solution, or to say that it's easy in any way. I know it's difficult, and I don't really have anything additional I can say to that. I just know it's hard. I know it's hard from personal experience.
Thank you. Next question. Indications are that case numbers are going up, but hospitalizations are not. Does that mean cases are less severe as the virus spreads across populations?
Dr. Wayman, why don't you take the stab at this one?
No, I think you should. You wrote it.
We got all
I'll
kinds of
try.
notes. Okay, so you and I were looking at some research I think it was last week. These weeks run together in my mind. So could it be that the virus isn't, as deadly, maybe the word as it used to be, or maybe it's weakened and it doesn't make people as sick, possibly. I mean, if that's the case, we don't have research right now that shows that. This is still a new virus and the situation's changing quickly. The research that Dr. Wayman and I was reading, which she shared with me, was, when people mask and social distance, since this is a droplet spread disease, the masks contain the droplets, and the distance helps the droplets not to go, not to travel so far away from you, so that other people are necessarily inhaling them or getting them in their eyes or whatever. But anyway, it limits, if you are exposed and you're 6 feet away, you have a mask on, the other person has the mask on. If you're exposed, regardless of all that, having that distance and those masks on probably means that you got a much less dose of exposure had you, as opposed to if you had been within the 6 feet and no masks. So, the less dose of something you get, the more of a chance your body's natural defenses has to fight it off. So I know there's probably a much more technical way Dr. Wayman could explain it, but if you get exposed to a smaller amount of the virus, your body's got a much better chance of fighting it off. So, early on in the virus, before we knew a whole lot about it, it was very likely that people that were getting exposed was getting much greater doses of the virus, because people didn't understand as much then about social distancing and masking and so forth. So that could be a part of it too. And then Dr. Wayman also talked about the changes in age. That we tend to have people that are younger now that are getting it. So maybe they just have a stronger defense. Of course, we know they do. We know there's more. The younger you are, the more likely that you're going to have a positive response, at least to the initial part of the disease. So I've kind of stumbled around that, Dr. Wayman. How can you correct me?
You did a good job. What we're finding is that in situations where there's been an outbreak, if masks were used, there were a lot more people that were asymptomatic, even though they were positive. So I think one scenario was where 80% of the people on a cruise ship that wore all the masks were asymptomatic. That's a big number.
Yeah, so they were exposed, but they were asymptomatic. So probably because they were masking, they had been exposed to a smaller dosage of the
Yes.
virus, and their bodies were able to fight it all. That's probably why there's less of an impact now in some of the nursing homes also as compared to the earlier outbreaks. Even though once it gets in a nursing home, it's still a very difficult situation. But it does seem like we see more asymptomatic positives in some of our nursing homes now. So probably the same situation. I had made some notes earlier about the average age of disease, or average age of folks who were catching this, and I must have saved a different version of our answers over the top of that, so I don't have that now. Anyway, that I think the average age right now is in the 40s of people who are catching it. Do you have that version, Dr. Wayman?
Yes, what you said is in July, the over 60 age group was 41% of the infected, whereas in September it's only 31. And it's about 40% are between the ages of 20 and 30 or 40. Anyway, they're young, so quite a large group are in the young age group.
Yeah. So there could be different reasons why that is, but we do know the social distancing and the masking helps. It helps you not to get it, and it may well help you if you are exposed to get a much smaller dose and give your body the best fighting chance to fight it off. Jimmy Green wrote in he's the judge down in Macquarie County, that he said in the chat box, I have not heard of any positive cases from the Bluegrass Festival. Some of our numbers are inflated from a correctional facility. What does being designated as a red zone entail? Schools, churches. So we can kind of answer his question while we're at it. Thanks, Judge, for clarifying you haven't heard anything from the Bluegrass Festival too. There's a couple different reports that will. There's a federal report and a state report that color codes counties based on the 7-day incidence rate. And I was trying this morning to go through the federal data set and compare it to the local data set to see why sometimes, they designate a county as being in the red, and at the state and local level we're not. And I just didn't have enough time to analyze the data. From what I could see looking at Wayne County, which was red in the last federal report, when I looked at the total cases they had listed, the difference between what we had local and the federal government had was only for Wayne County 3 or 4 cases. So their data set was real close to what we had. And what they were dividing by, the population size, they were using the same census data that we were using to determine the population. So, I'm not exactly sure why that is off. There may be some other things that they're putting into their formula other than just the 7-day incidence rate, which is what the state uses. So anyway, the judge asked, what does all this mean? The governor's office and the Department for Public Health at the state level put together a 4-layer color coding system: red, orange, yellow, green. If you're red, that means you have 25 or more cases over a 7-day average per 100,000. So you take how many new cases you've had each day for the last 7 days, divide it by 7 to get an average for those 7 days, and divide that by or into your population size to determine your incidence rate. You do the adjustment to make it per 100,000. So if you're having community spread or new case rates at 25 or more per 100,000, you would be in the red zone. The green zone is 1 or less per 100,000, and then the yellow and orange I don't remember the numbers, but they're in between those. So what does the red mean? It's been offered as guidance for the school systems. If you see your county is in the red, that would be an indication that that you're in a hot zone of community spread at the moment, and having in-person instruction probably wouldn't be the best ideal. And I'm pretty sure I heard in the governor's update a few days ago that they were going to use some similar uh, version of that as far as nursing home visitation. Again, I don't know the details of that. Uh, Stuart, you might know more than me. The old guidance was, you had to have not had a positive case for a certain length of time. That's probably still in place. And do you know more about
Yeah.
it, Stuart? More details?
Yeah, I don't know if that, of course, they did, at one time, community spread was uh, added in there, but now, in the earlier question we answered with that new guidance that the CMS and Inspector General's office have put out. I've not had the opportunity to look at that, but I think that may have changed some of the visitation things. I know that that they are encouraging nursing homes to allow visitation, and if not, that they do have, there is rationale for that. But I'm not familiar with what the guidance that CMS has put out there. I will also say, Judge, that if you are a red zone county federally, so in that would mean that you're looking at closing bars, which of course McCurry County it doesn't have those. So, or looking at, I believe you have to bring your restaurant capacity down, maybe to even 25%. And of course, in those states that don't have mask mandates, then that would be something that the White House would encourage if you were a red state. So here we're talking just about a red county, but I think it would go hand in hand. So what the state has, especially with the schools, then the White House has some guidance than otherwise for some businesses and things to try and slow the spread if you are in the red zone.
Yeah, my personal opinion would be that the federal report is probably better for looking at state to state data as opposed to county specific data in each county. The best information you can get is from us at the local health department, because we record cases daily based on lab confirmation. Now there's a very, very rare instance where we would add a case without a lab confirmation, but 96, 97% of the cases we record each day, we have a lab confirmation in our hand. So that's the best place to get the most current information. And then the next best place to get current information would be off the state site. It ends up matching our information. It's just maybe on a couple day delay because they have to validate their data a little bit differently than us. But we reconcile our local data set against the state data set a couple times a week to make sure that they're having the same numbers. They have the same numbers that we have. So I'm very confident their data set's accurate. I'm very confident our data set's accurate. It's just that they report things on a couple days delay, oftentimes, as opposed to us, where our information's pretty well current to the moment. So I would encourage you to use our local website for the information in our 10 counties, using the state website for information about any other county or statewide information, and using the federal report, so you can compare state to state. And again, as Stuart said, the federal guidance is to help point the states toward what you should do when you get to a certain level of spread to try to slow it down. And it's the same kind of thoughts that basically they dovetail very well with the same kinds of thoughts that are coming out of the State Department for Public Health.
Thank you all. Next question, and this is for you, Stuart. I saw a post today where someone said they were in a sandwich shop and the person making the sandwich had on a mask and gloves. However, after making the sandwich, they took the money with the same gloves on and went on to make another sandwich with the same gloves on. I have seen this in similar situations. I'm going to turn it over to you, Stuart, and let you answer that as far as environmental department here at the health department.
Okay, so there's two sets of guidance that a restaurant has to follow right now. Normally it's one. Normally it's the food code that, of course, the health department enforces, and our inspectors are out every day and they check for that, and they help the restaurants make corrections that need to be made. But right now there also is the guidance, COVID guidance for restaurants. So yes, it's absolutely correct that the employees should be masked if they cannot maintain that physical 6-foot difference. So, and it sounds like this place is doing that. So that's very good. They are supposed to be gloved when they have interactions with customers. So when they're taking cards, when they're exchanging whatever form of payment it is, handing them their bag of food, they're supposed to have gloves. This person was doing that. That's good. Now, food code. Food code says that you have to wear, or you have to have, let me say that you have to have a barrier between your hands and ready-to-eat food. So ready-to-eat food is going to be sandwich meat or something that's already been cooked up, and you're going to make a hamburger or whatever that is. So a salad, ready-to-eat food. You have to have a barrier. And a barrier can be tongs, could be maybe me giving you a donut with a deli tissue, or it can be gloves. And again, this person was wearing gloves. Now, beyond that, the food code does state when you are switching functions, when you switch duties. So whenever I'm going from fixing sandwiches to working at the cash register, then under normal circumstances, you wouldn't have to wear gloves to go and work the cash register. But now that we have COVID, you do. So what people would need to do is when they switch their gloves, they need to take their old gloves off, wash their hands, put the new gloves on, and go to a new duty. When they go back to preparing food again, they need to take those gloves off, wash their hands, and put new gloves on. So, I mean, that's common in restaurant sanitation. The only thing uncommon at this time is where you have to wear gloves whenever you're processing those payments. But you have switched duties, so even though gloves are required, you need to do a switch of gloves in that case. And of course, when you go back, and always hand wash in between, you always hand wash in between. And remember, what this person was correct in pointing out about gloves is just because you have a barrier on your hands, there's no reason to have gloves on at all if you're going to make somebody's sandwich. And I'm just going to put this, as an example. If I'm making somebody's sandwich and then I take out the garbage and I come back in and make somebody's sandwich and don't change gloves, the only thing the glove done was keep the garbage dirt off my hands. It's on your glove surface, and now you've transferred it to that ready food that the person's working on. So, in that instance, I would say the glove didn't do you much good. But anyway, as this said, yeah, we want people to switch their gloves when they switch duties. Every time they do that, they need to wash their hands in between. So new gloves and hand washing.
Tracy, I've got one note I added about talking about the change in school guidance a little bit. Did you have any other questions?
I do not have any other questions.
Okay, so if anyone that's listening in has a question you'd like for us to take a shot at answering, now's the time to type it in because we're getting ready to wind down here. So a couple of fairly significant things changed with the school guidance in the last few days, and we've got a meeting scheduled with all the school superintendents coming up shortly to make sure they're aware of this and to have a discussion with them about how to make this as successful as possible. We certainly want the schools to be successful and as safe as possible. I know the superintendents are very passionate about their schools and getting the kids in schools, and they've put a lot of effort into putting their plans in place. So we want to support them as best we can. I can say off the subject of schools for a second, when it comes to businesses or long-term care facilities, a couple that pop into my mind, there was a lot of effort put into helping people come up with prevention plans, how to take steps to prevent COVID from getting into your facility, about spacing and putting up barriers and wearing masks and increasing sanitation. So there was a lot of that planning, and then we had to switch as cases started getting in. Because when this disease, you put these prevention measures in place, but the prevention measures don't ensure absolute safety. They simply reduce the risk. The more safety measures you take, the more you reduce the risk. But reducing the risk doesn't absolutely totally eliminate the risk. So regardless, there are going to be some situations where a positive case is going to be at a facility, an employee or a worshiper or whatever, if it's a church. So, in all of these different settings, we've had to work with places on what do you do after you've had a case. You put all the effort into how to try to prevent it, but when a case slips through the cracks and it gets inside, then what do you do? The post-exposure plan, not the prevention plan. And we've gone through this scenario with long-term care facilities. We've gone through it with churches. We've gone through it with businesses, and now we're going to have to go through that with the schools. The schools have done a tremendous amount of planning for prevention, and where we can see there's some schools that are already open, and there's already some cases that are getting into the school, and we're going to have to put a greater emphasis on the post-exposure planning. So saying all that, I get back to what guidance has changed from the state level. Uh, One is the previous state guidance said if your county was in the red zone of community transmission or 7-day incidence, meaning you're having an average of more than is it 25, Stuart, or 20? 25 or more. 25 or more new cases per 100,000 average, that you would be in the red zone. And if you're in the red zone, it would be recommended not to have in-person instruction. And the previous guidance said it's recommended you would stay out of in-person instruction until your county went back down to the yellow level. So you go from red back through orange down to yellow. And it was decided that using that system, it would take a tremendous long time for certain counties to ever be able to get back to in-person instruction, to get all the way back to yellow. So it was changed to say that if you get into the red, I'm pretty sure it said that you should be recommended to be out of in-person instruction for a week, and then you could return as long as you were out of the red, even if it was in the orange or yellow. So that should enable schools to be able to get back into in-person instruction sooner. So that was one change. The second change was how you define a contact. And schools presented a particular, a kind of a little different challenge than a lot of other settings, because you were in a standard size classroom. You're talking about a pretty good number of people being in that classroom for several hours a day. So if there's a case in the classroom, what degree of risk is there that everyone's going to be exposed over the course of a day? So all the local health department directors and the commissioner of public health got together. I guess it was yesterday, and we discussed this, and we tried to come up with something we thought was as that reduced risk, but that wouldn't end up quarantining the whole school. So what we came up with was, if the classroom is appropriately spaced, meaning that the kids are at least 6 feet apart, and that they're consistently wearing their face coverings all day, then if you are beyond that, if you have a case that comes to school and the kids that are in the classroom are outside of that 6 foot zone and they've wore their mask consistently all day, that they wouldn't be considered a close high risk contact and wouldn't necessarily have to quarantine. So that was where we arrived, and that's fairly consistent, I think, with what we've done in other settings, like factories. But none of this is really easy. I mean, people want this to all fit into a cookie cutter, but it's not easy. Meaning that you can have a classroom and maybe for some reason they were allowed to take their masks down for an hour. So now you have to look at the situation differently, or were they allowed to get up and mingle around the room for some activity for a period of time? So now you've got that complication you have to work through as a clinician trying to use judgment. Would there have been any reason why they had singing in class or whatever, where you're projecting out more droplets? So those things make it more complicated. My advice to the schools would be, make sure you're keeping the kids spaced while they're in the classroom and keep their masks on. That's going to decrease the number of people that end up being quarantined. So, if you're a parent that feels like you want your kid in school and you're not so concerned about COVID-19, then that's good news for you. If you're a parent that's more worried about it, that may not be so good news for you. So if you don't think that's good news, I would encourage you to look at the state website where the schools are reporting how many cases they have per day, and use that information to decide whether or not your student needs to be in-person instruction and make an individual decision from your home. So, Stuart, do you want to add anything to that?
I just want to say, on that, of course, this is going to now require, and schools have been required since August 31st, to wear masks. So this is, if schools are not wearing a mask and they end up with a case in that classroom, and that case, if that case is in high school, a typical high school that has 7 classes, that's 7 whole classes quarantined. But this document now, this guidance, it really puts a lot of emphasis on masking, and we know that emphasis should be on masking. That masking is what helps us. That actually is the single most important thing that we can do besides distancing and washing our hands. So, it's, we're glad that as public health, we're glad to see that in. No matter what opinions are out there as far as masking goes, we know we have the science behind that. Even as Sean had talked about earlier, Dr. Wayman, that masking, if you were exposed, could give you less of an exposure, less of a sickness potentially. And then, of course, from that, then you would have some immunity. So we're not, I think the changes that we have now is going to really help our health department contact tracers with something a little more definitive. It'll take some of the judgment out. There's still going to be some judgment, like Sean said. I mean, a class may still be doing some high-risk activities. Just like you said, maybe they're up walking around each other in the class. Maybe they are singing or shouting or cheering. So high-risk activities like that, that's going to move them back towards a potential quarantine. But all in all, we've looked for some of this additional guidance for several weeks now, and we have that. And as Sean said, with the Department for Public Health and all the health departments in the state, a lot of public health professionals have agreed that this is some good guidance that we have. Of course, if we see with school openings, schools weren't supposed to open until the 28th of September. And a lot of schools are waiting until after fall break. So the bulk of the schools are going to open up week after next, the state. So if we do start seeing transmission even through some of these additional things that we put in here for guidance on quarantine, I suspect that'll be changed. We will have to learn a little bit of this as we go. Right now, all the data that we have suggests that this is good guidance, very good guidance. But if we see that change, if we see that we're having more exposures in those classes, more kids that become positive, then we'll change that guidance, and there could be some more future, more restrictive guidance that comes about after we see schools in for a period of time.
And we're still not entirely certain what impact in-person instruction will have on community spread. I know a lot of people say, well, the kids are the least likely to get sick, and that's true. So, there's other health consequences that can happen to people, other than just getting through the initial, having those initial flu-like symptoms and recovering from that. There can be long-term side effects of this, or lasting effects of COVID-19 that, is not fully understood what causes that, or how many people's going to get it, or how long it would last, or whatever. But let's just argue, for argument's sake, that kids are the most likely group to be okay, which it looks like that's absolutely true. But we don't know if the kids, if they'll catch it and be asymptomatic and take it home to mom and dad, and then mom and dad takes it to work or to church or whatever. So, and then you see 3 weeks after a school opens that you're starting to have a big increase in the community, 3 weeks or 6 weeks. When something changes, it takes a while to see the difference in the statistics in the community. It may take 3 weeks to see the beginning of the changes. It may take 8 weeks to start seeing the real impacts of that. So, it is absolutely our hope that we don't see a large increase in community cases from in-person school instruction. This is a big deal for our communities. A lot of stuff is open, at least to some degree, and this is another step back to normal for our communities. Even though school's not completely normal this year, this is a step getting us closer to normal, and we want it to be successful. And we certainly hope that it is. So, Tracy, that's all I have. If you want to start winding us down, did Dr. Wayman or Stuart, did you all have anything else?
No.
So Tracy, you can give us our usual guidance of what we should do to protect ourselves and wrap us out.
Mask up. Sounds like we all need to be masking up and social distancing and washing our hands frequently. Also, I want to say, Dr. Wayman, again, we need to get our flu shots. So if you have not done that, please go out and get your flu shots. And as far as for next week, if you have questions, please send them our way. And we will be back next Wednesday, which is October the 7th, I believe, at 2 o'clock to answer questions and share updates.
All right.
Well, have a good day.
Bye-bye.